Thank you for joining me for another episode of my story, Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Wednesday, August 25th, 2021. Today's episode is about for African Americans with lupus. Lact-Cer may help predict heart disease. Also, clinical challenges for diagnosing a painful skin condition which causes abscess. Hidradenitis Suppurativa. Also, we'll finish up the story on injecting cocaine into your spine for science. So, you know what I want you to do. All the way from the United States to Santiago, Chile. Get ready to grab your cup of coffee, your cup of tea, and to my listeners late at night, you know I appreciate you. Get ready to grab your favorite glass of wine and join the conversation right here on my story, Living with Lupus podcast. The views and opinions expressed on my story, Living with Lupus podcast, represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My story, Living with Lupus podcast, is officially trademarked, all rights reserved. All right, and before we get started, here is another disclaimer for you guys. You know, on Monday that I will be having a biopsy performed due to the fact that they are trying to rule out cancer. And oftentimes, my voice may sound hoarse while doing this podcast. Just know that that is due to a suspicious growth on my neck. So at times, like I stated, I will sound hoarse, and oftentimes I begin to strain just to talk. So let's get started with for African Americans with lupus. Lact-Cer may help predict heart disease beyond conventional risk factors. A new study finds Lact-Cer, a type of fat found in cell membranes and circulating in the blood, may help predict or diagnose heart disease in African Americans with lupus. People with lupus have a much higher risk of developing heart disease compared to the general public and the African American community. is at an increased risk as well. Excuse me. Yet, African Americans also tend to have lower blood levels of triglycerides and higher levels of HDL, which is considered the good cholesterol. Traditionally, signs of low heart health risk, more effective screening and diagnostic tools for this population are clearly needed. The study included 51 African American people with lupus. Study participants were also predominantly female. Researchers found that low levels of Lact-Cer were associated with higher amounts of artery clogging plaque, a sign of heart disease. Thus, including Lact-Cer may offer an added benefit to the conventional blood lipid panel. A common blood test that traditionally only measures triglycerides and cholesterols as indicators of heart disease. Additionally, high levels of Lact-Cer were associated lower levels of complement proteins, which are the C3s. Now, low C3 is linked to flares and organ damage in lupus, and the researchers note Lact-Cer may therefore offer another marker of lupus disease activity. Lupus is 2 to 3 times more prevalent in women of color, and research has found that Black women are more likely to have organ system involvement and more active disease compared to white women with lupus. Developing more effective health screening and diagnostic tools, as well as treatments for the African American lupus community, is vitally important. Stay with me. When we return, we'll talk about the painful skin condition which causes abscesses. It's challenging in the clinical field for diagnosing HS. So stay with me. Deceived from Within, Living with APS and Lupus by author Darren Radke. To purchase his inspirational book, go to www.deceivedfromwithin.com. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. Painful, long-term skin condition which causes abscess. Clinical challenge in diagnosing it. Knowing recognizing, acting on distinctive signs help build trust in weary patients. We're talking about HS. Clinicians and patients alike can make a strong case that diagnosis is the biggest challenge for HS, or more specifically, making the correct diagnosis and making it early. A recent multinational survey of patients with HS captured the diagnostic confusion and missteps, as well as patients' frustration resulting from inaccurate assessments of the disease. Almost two-thirds of the 1,300 patients said they had been evaluated by a physician at least 5 times before the correct diagnosis was made. The time to an accurate diagnosis averaged 10 years. By the time clinicians arrived at a diagnosis, more than 80% of the patients reported flares that occurred at least monthly, including daily flares in almost a fourth of the survey participants. More than 60% of the patients responded moderate to severe pain. 43% said HS had an extreme impact on their quality of life, and 14.5% reported being disabled. Another recent report showed that misdiagnosis by non-dermatologists represents one of the biggest barriers to accurate and early diagnosis of HS. Almost all of the patients in the study were reported to have a diagnosis of an abscess or inflamed cyst or acne or cellulitis or MRSA or something like that. Some people are just being mischaracterized as having an acute infectious disease rather than a chronic inflammatory disease. The study also suggests that some patients delay seeking a diagnosis or care because of the embarrassment. HS arises in sensitive areas of the body that may be difficult to talk about or reveal to a clinician. The axilla, growing inflammatory fold of the genital areas. Patients don't know with whom to seek care, so they just end up going to the emergency department. A lot of patients don't have health insurance, as HS unfortunately affects patients with skin of color to a greater degree than white patients. Historically, dermatologists, the medical specialists most familiar with HS, have not been the first point of clinical contact for patients affected by the disease. Fortunately, the situation has begun to change over the past 2 or 3 years, at least from the perspective of the Chicago Skin Clinic, the messaging for HS has improved, and seeing a lot more patients in milder stages, which is good because we can help prevent them from progressing as quickly or having long-term scarring. For a clinician familiar with HS, certain signs and symptoms point toward an HS diagnosis. Localized pain, swelling, tenderness of the affected area, as well as warmth to the touch in an affected area. All those indicators can also overlap with a diagnosis of infection. Adding patients and lesion characteristics to the diagnostic workup can also help guide the diagnosis toward or away from HS. The typical patient is in middle age, more likely women, overweight, obese, and has an inter intergenous site of involvement. The double comedone is not found in many other conditions. So, just having two open, seemingly large pores over a large nodule is a very specific sign. As the disease progresses, signs of more advanced disease, likely requiring surgery, begin to emerge, including nodules and abscesses with underlying tunneling and scarring. Arriving at an accurate diagnosis and providing reassurance that HS can be treated can provide the cornerstone for building trust with patients, particularly those who have seen multiple clinicians and obtain little satisfaction from the encounters. Building the trust can be the biggest challenge to successful management of HS. Guys, you have to excuse my voice. I forewarned you in advance. Stick right with me because the conclusion of injecting cocaine into your spine for science is up next. So stick with me. All right, we're here to close out on injecting cocaine into your spine for science. Yes, doctors actually did this. And we have to look realistically now. Back in that time, of course, they used it, for medical purpose and also for their pleasure. But we left off talking about Coca-Cola and Pepsi having cocaine in it. And I remember a point in time that growing up as a child, my parents would not let me drink Coca-Cola or Pepsi. And I never knew why until later on when I got of age that it actually had cocaine in it. And I believe that's why some of those, I shouldn't say some of those, well, some people, got hooked on that Pepsi and Coca-Cola because of that cocaine. Allegedly. Let me put it that way, allegedly. Okay, but you might not know that cocaine was indeed commonly used in medicine around the turn of the 20th century. German pharmaceutical company Merck, a major player today, started by producing small amounts around 1860 through the 1870s. Total annual production was only 50 grams of cocaine, which frankly is a quiet night for some of my friends. From the 1880s, its medicinal uses really took off as Merck started marketing it as a cure for morphine addiction. So we're trading one addiction for another. You go from morphine to cocaine. A young doctor called Sigmund Freud, we've all heard of him, wrote a glowing 70-page document called Uber Cocaine. It was Freud's friend, Dr. Kohler, who realized its use as a topical, meaning on the surface, an aesthetic agent for the eye, not only numbing it, but reducing bleeding as well. Now, in 1885, Merck produced 83,343 kilograms of cocaine, which the author of this stated, frankly, is a quiet night for some of my friends. Here are some patents taken out around this time. Cocaine toothache drops, Metcalfe's coca wine for fatigue of mind or body, and voice tabloids with cocaine, pot hash, and borax. In 1887, the U.S. Surgeon General recommended that cocaine be used to treat depression, claiming that there was no such thing as cocaine addiction. This was when William Halsted, about whom you've already heard, started experimenting on himself. Have you ever wondered why U.S. doctors start rounding their patients so damn early in the morning and work such crazy hours? It can be directly traced back to Halsted, whose manic nature and work ethic, driven in part by, guess what? Cocaine, combined with his huge impact on modern American medicine, has resulted in generations of residents starting their ward rounds of patients at 5 a.m. for no good reason. Now, the author of this further states, now I literally wrote the book on recreational drugs and the heart. And believe me, cocaine is not advisable. It can cause heart attacks in even the most healthy young persons for a number of quite interesting reasons, such as making the blood vessels spasm and kind of clamp shut as well as making the blood itself more sticky. Instead of doing cocaine, why not do what I do when I want an upper? Watch some forbidden movies. That was the end of injecting cocaine into your spine for science. And do you think, let me pose this question to you. Do you think because of what you heard that that is why some physicians are known to some as the biggest drug pushers of all time? And do you feel that when those doctors make those early rounds at 5 o'clock in the morning, that it's either a manic state or is it their work ethic? A manic state with a little cocaine enhancement? Or do you basically think it's their work ethic? This this story had me thinking a lot. We know doctors keep crazy hours, and I often wonder, how do they stay up during those hours? Is it because they drink tons of coffee? Is it because they're physically fit and they take those little bottles of that energy, those energy shots? What is it, 24 hours? But that's something to think about, you know. And I'm quite sure that there are some doctors allegedly out there who have to take a substance to keep them going because of the hours that they work. But what are your thoughts? My thoughts may be totally absurd and wrong. Um, I had a conversation with my sister this morning, and I told her my doctors, all of my doctors I go to tell me, Susan, we got to get you off of some of this medicine. So we're going to use a holistic approach along with the Western approach of practicing medicine. And I said, how many doctors do you, I'm talking to my sister, go to and state that you're on too many medications? Let's try to get you off of some of these medicines until we find out what's going on with you, because we don't believe in putting you on all of this. We want to use a holistic approach along with traditional um, Western use of medicine. And I appreciate that about my doctors. They are not the kind of doctors that'll say, okay, here's a script, go get it filled, just to get you out of the room. And I appreciate that of with my care team and everything they do, because they're not trying to push different types of meds on me. And they know that they can't push different types of meds on me, because the first thing that I'm going to ask as a patient and a healthcare consumer, what are the side effects? And if you start running off the side effects, the answer is no. And I tell you this, just like my gastroenterologist, I seen her last week regarding the gastroparesis, and she said, Susan, I would love to place you on the Raglan. And the first thing I said, what are the side effects? She said, that's the problem. That's why I'm not going to place you on the Raglan. She said you would have involuntary twitching of the face. And I shook my head. I said, no. She said, that's what I'm talking about. No, I'm not going to do that to you. So we have to work on this to see what works for you and what doesn't. And she told me, the normal what size meals to eat. But see, I'm still on baby food and applesauce. And today I'm going to prepare some mashed potatoes because I get tired of baby food and applesauce. And so I asked her, will my stomach ever go down where I don't look like I'm pregnant to get into a normal size pair of pants that I, in my closet? And she said, yes, but it's going to take time. So, a portion of me, you could tell where I'm losing weight, but my stomach looks like I'm pregnant, and that's not going to work with me. So, yeah, but what are your thoughts on this? Do you believe doctors partake allegedly in substances, or do you think it's their work ethics, that they have a very good work ethic to do their rounds early in the morning? What are your thoughts? Let me know. Stick with me. When I return, I want to leave you with a message. Well, it's that time for me to go. I would like to thank you so much for tuning in to another episode of my story, Living with Lupus podcast. I want to leave you with this. All around the world, God is giving and sustaining life to the praise of His grace. His mercy is new every morning, and it's always morning somewhere. And if you happen to see something behind me, don't be alarmed. That's just goodness and mercy following me all the days of my life. I'm Susan Hendricks for my story, Living with Lupus podcast. Have a most safe, peaceful, and oh so blessed week. I'll see you next time for another episode.